So thank you again and welcome for being here at the Tribal Public Health Accreditation Foundation of Public Health Services training session. My name is Mary Frances Montel and I'll be the moderator for today. Let's go over some Zoom housekeeping rules to make this experience the best for all. Go ahead and please keep yourself muted when not speaking. We welcome you to have your camera on, but it may affect your bandwidth and therefore your video and audio, so it's fine if you don't have your camera on. At the same time, you can use the CVent website chat and Q&A options, but we prefer to use the Zoom chat here. That way we can all see each other's questions and comments. If you do lose the connection to the Zoom meeting, please feel free to try reconnecting or use the calling number, which I will go ahead and provide in the chat if needed. As a special reminder, there will be a session evaluation available at the end and an overall evaluation for you to complete. We aim to make this experience great, and we really do appreciate your feedback. So I'll go ahead and now start by introducing today's speakers. All right. So Alina Kawe is our main presenter, is the president and CEO of Red Star International. Alina is a national leader and advocate in Indigenous health with more than 25 years of experience working in partnership with communities to transform ideas into action. In 2018, she received national recognition for developing the first public health institute in the US to focus solely on Indigenous well-being. For the last decade, Alina has focused on building public health capacity and public health accreditation readiness among tribal and Pacific Island public health systems in the US. More recently, her focus has shifted to exploring the role of governance and promoting the well-being of humanity and environment. Prior to Red Star, Alina served as the Pascual Yaqui Tribe Education Director and as the administrator of the American Indian Research Center for Health at the Intertribal Council of Arizona. Alina is an enrolled member of the Texas Band of Yaqui Indians with cultural ties to Pascual Yaqui Tribe, Old Pascual Pueblo, and Tucson, Arizona. She has a master's degree in public health from the University of Arizona. Our other presenter today is Teresa M. Carino. She is the Senior Project Coordinator for the Red Star International, where she works with tribes and tribal organizations in the areas of commercial tobacco prevention, cessation, and community wellness, including the relationship between the environment and our health. Teresa is co-author of the workbook More Than 5 A's Implementing a Commercial Tobacco Cessation Intervention in Tribal Communities. She has a master's degree in multicultural education and is a former high school administrator, teacher, and public health educator. Prior to working with Red Star, Teresa was the principal of a charter high school for the Pascual Yaqui tribe in Tucson, Arizona. Her 20 years of work in educational leadership and public health serves as a foundation for her ongoing work in our tribal communities and beyond. And we have a special guest with us today, Marita Chilton, the Director of Accreditation at the Public Health Accreditation Board, where she was responsible for managing the operations of the accreditation program. Prior to joining FPHAB in 2011, Marita was a project coordinator at the National Association of Local Boards of Health. She holds a master's in public health from American Public University, a graduate certificate in leadership and management from the University of Notre Dame College of Business, and undergraduate degrees in political science and intercultural studies from Fresno Pacific University. Thank you, Alina. Thank you, Teresa, and thank you, Marita, for being here today and for being part of the SPTHB Training Summit. And I will now turn the time over to you.
Alina, I think you're on mute.
There we go. Thank you. Thank you, Mary Frances, for the introduction. It's an honor to participate in the Southern Plains Tribal Health Board 2022 Training Summit. Welcome, everyone, to the Tribal Public Health Accreditation and the Foundational Public Health Services Training. We're so excited to be co-presenting with the Public Health Accreditation Board, Marita Chilton, today, and to share the most up-to-date information. There we go. Before we get started, we thought we'd share just a little bit more information about Red Star International. We're an Indigenous-led nonprofit organization whose mission is to advance Indigenous self-determination for the well-being of humanity and the environment. And we do this work across 3 primary focus areas. We believe our communities know the way forward and that collectively we have the power to heal the systems and power structures that perpetuate the inequities experienced by so many of our communities. And we believe public health accreditation is an important tool that tribes can use to build public health capacity and transform their systems. And so you've all had a chance to meet us during the introduction a few moments ago. And I would like to introduce another member of the Red Star team who has joined us today, Chris Rhodes. So you'll see her in our gallery, and just really glad she could be with us today. But before we get started, we wanted to take a moment to meet all of you. So I'm going to stop sharing and hand it over to Risa to do some introductions.
Hi, everyone. As Alina said, you've already had a chance to meet our team and your moderator here. So I just put into the chat, if you could share your name, title, and tribe and organization, if applicable, and something you're passionate about in public health. And we will all share as well.
You can go ahead and start us off as the moderator. So I've introduced myself as Mary Frances Montel. I work here at the Southern Plains Tribal Health Board as the Tech Fee Program Manager. I'm originally from Puerto Rico, and something I'm passionate about in public health, really just generally as a subject, I'm very passionate about public health. I didn't start out in it in my undergrad. I kind of had to discover it on my own. And as soon as I found out, that this is a way to help people and to really engage with communities, I fell in love with public health, and I've just immersed myself in it ever since. Thank you.
Thank you.
Would anyone else like to, and I see people are writing into the chat. Looks like Melanie's passionate about wellness and suicide prevention. Amazing. Would anyone else like to unmute and share aloud with the group?
I'll share. Good morning. My name is Bree. My real name is Britannia. I'm CXW from Canyonlands. I'm from northern Arizona. I'm Navajo. What I'm passionate about in health is probably just helping as many people as I can take back their lives in diabetes and hypertension. We've been working a lot with people in that area, and just to see numbers just flip people's lives. Guy who was in a wheelchair, he's starting to walk, and just take accountability for things that he eats, and just his day-to-day. So that's mine.
Thank you, Bree. Amazing. Thank you all for participating and sharing your passions. I love reading them in the chat. I'm going to go ahead and drop a link to a folder in Dropbox that has our presentation slides, as well as a worksheet that we're going to use later on in the presentation.
Okay. Great. So we'll go ahead and give an overview. So I'm going to return back to the presentation here.
Awesome. Thanks, Lena. So now that we've all been given a chance to get a sense of who's participated in the session today, I'd like to provide you with a brief overview. So we'll start by providing an overview of public health accreditation and what's new in the recently released version of 2022. We'll then discuss the benefits of accreditation and foundational public health services as a tool for building capacity, and highlight the multiple pathways to accreditation, including the 3 options available to health departments who are interested in improving their public health performance. Then we'll wrap up by sharing strategies and tools to help determine a pathway towards accreditation readiness. Of course, we do have a lunch break built in. If you have questions at any time, please feel free to drop them into the chat. But before we get started, we kind of want to do a quick poll to see and get a sense of how familiar everyone is with public health accreditation. So I'm going to drop a link into the chat, and I invite you to participate in this poll. All right, trying to see some results here. I will share my screen so we can all see people's familiarity in the room. Let me share screen. Looks like we have a variety of levels. Some are new, some familiar. Awesome. Looks like we have, looks like just about everyone who's participated. Let me just double check. Yep. All right. Thanks, everyone. And we'll be using similar polls and things later on in the session. I'll turn it back over.
Great, thank you. Let's see. Oops. Bear with me for a second. I hit the wrong button. There we go. Okay, well, this will be great for the group that we have, especially those who are brand new to public health accreditation. But I think also for those of you that are somewhat familiar, it'll be a good refresher. And just from my experience, when I've had other people say, I've attended your presentation a number of times, but every time I hear something I didn't hear before. And a lot of that has to do with just our readiness to take in new information. Because when we're first learning about accreditation, it can feel a little bit like drinking from a fire hose because it's just so much information. So we're really going to start with some of the basics today. But I always like to start our presentation recognizing the sovereignty of our Indigenous peoples, and that really we are the original architects of systems or ways of life that have kept us healthy. And these traditional life ways include our foods, our connection with the natural environment, our traditional games, healing practices, physical, emotional, and spiritual well-being, our medicines and intergenerational relationships, our traditional practices, all of which kept our communities healthy and resilient since time immemorial. And so what do I mean by systems? And I look to the rosette as a metaphor because it's about more than just the individual beads. And like a rosette, it's about how they are sewn together. So much like our relationships and ways of being and our processes and how we interact as an interconnected whole. And so how I was taught was to always start with a vision in my mind and to always bead with good intentions and thoughts. And I think we need to approach our system transformation with our tribal public health systems in a very similar way. But what happens when our ways of life are interrupted? How does that impact our health, especially today? We know that forced assimilation policies have essentially dismantled those systems that kept us healthy for so long. Our education was removed from our home into boarding schools. How we live changed from communal living to individual allotments. There were bans on our traditional practices. We experienced disconnection from our land, and our health and well-being and our healing went from being a way of life to a Western model of healthcare. And so when we talk about healthy systems, we have to think more broadly than just our hospitals and clinics. We need to think about more of all the different determinants that impact our health. And so I'd like to share this model from Margaret Greenwood in 2015 for the social and cultural determinants of Indigenous health. And this model comes from Canada and is a community-centered model that puts our children, families, cultures, and Indigenous nations at the very center. So to understand some of the factors that determine our health, we need to recognize and acknowledge that our communities interface with non-Indigenous structures and systems as well. And within those interfaces, our communities experience the impacts of colonization, marginalization, and dislocation. And so this in turn has a direct impact on the determinants of health, which you see listed on the left. And this includes our early life, our education, employment, housing, etc. And tribes are really in a unique position to be able to ensure that our systems, our services, our processes, our relationships, our policies are all aligned with our values and our worldview. So understanding these determinants and their interrelatedness is important when we start looking at transforming our systems from just a medical model that focuses on healthcare for individuals to one that is public health focused that seeks to improve health of a whole community. So when we talk about health, we're talking about, public health, we're talking about more than just our efforts to promote or prevent disease, but the various activities we do that aim to provide the conditions where people can be healthy and well. So again, unlike healthcare that focuses on individuals, it really focuses on entire communities and how different partners and stakeholders work together to improve health. I really like this graphic from the American Indian Cancer Foundation. And while this graphic focuses specifically on healthy eating, it provides sort of that aerial view of a community and shows how all the different places and partnerships that exist within a community and how they're working together for wellness. And that really is, to me, what public health is all about. So imagine your tribal public health system where you work or live. Think about all of the partners that work together who have the community's health at the very heart, the very center of what they do. And this can include your tribal government. It can include your health clinic, other federal agencies. Some tribes work with private industry. We have relationships with our local and state governments, tribal epicenters, tribal colleges. We have other community organizations. All of those make up a system of partners. And so for each tribe, those partnerships look different and they have different roles and different functions. And a lot of that has to do with capacities, resources, and relationships. So when we talk about tribal public health systems today, we're really talking about those partners and how they work together to provide the conditions in which people can be healthy and well. The 10 essential public health services reflect the essential activities that tribal public health systems can implement for healthy communities. This framework was created back in the 1990s, but has evolved to provide a framework for public health that is centered around health equity. And so just quickly, the 10 essentials include how well we assess and monitor health status, how we investigate, diagnose, and address health problems and hazard affecting the community. How do we inform and educate people about their health and the factors that influence and how they can make changes to improve it. How we strengthen and support and mobilize communities and partnerships. How we implement and create our policies, our plans and laws that impact health. How we utilize legal and regulatory actions to protect health, ensure that we have an effective system that enables equity and equitable access to services, to build and support a diverse public health workforce, how we improve and innovate in public health using evaluation, research, and quality improvement, but also how we build and maintain an organizational infrastructure to support our public health efforts. So when we start thinking about a public health accreditation, we're really looking at how we can strengthen our tribal public health system and how our partners work together to implement these 10 essential services. And this is often referred to as public health performance. So how well is our system performing these 10 essential services? So what is public health accreditation? It's similar, many of you might be familiar to other accreditation programs such as Joint Commission or PHAB, and it's similar in that it provides a tool for quality improvement, excellence, and accountability in programs by providing standards to meet and measures that indicate if you meet those standards. But what we like about accreditation is that it's far less prescriptive than like Joint Commission and PHAB. It also respects tribal sovereignty in that it tells you what the standards are, but it's really up to the tribe to determine how to best meet those standards. Its focus is on public health, so not the care delivered in our hospitals or clinics, which means it focuses on a much broader set of services and programs that serve our communities. And so you'll hear us use the acronym FAB, and some of you might be familiar with that, but it stands for the Public Health Accreditation Board. And FAB is the accrediting body for governmental public health, including tribal, state, local, and territorial public health departments. And their vision is that the national public health system be a high performing to support all people living their healthiest lives. And so, of course, that is going to include our tribal communities. We sometimes get asked if urban Indian programs can be accredited, and the answer, unfortunately, is no, not at this time, because they're not a governmental public health department. And I'll explain a little bit more about that shortly. So public health accreditation has been around for nearly 11 years now. It's hard to believe that. But there was a great deal of work done over the 5 years during its creation, including the work of the National Indian Health Board and their Tribal Public Health Accreditation Feasibility Study in 2008. And that's when our team started working in this area. We helped with NIHB in the facilitation of that feasibility, and later went on to work with FAB to facilitate the Tribal Standards Work Group to develop the tribal standards for the first launch of accreditation. And we've continued to provide training, workshops, and resources on accreditation for the last 12 years. But today, there are 5 accredited tribes, 40 states, and 305 local health departments. So it's really exciting. But we'll hear more about tribal engagement and accreditation from Marita a little bit later in the presentation. So here's the FAB definition of a tribal health department, which is used to determine eligibility for public health accreditation. FAB worked with NIHB and an Indian law expert from Alaska to develop this definition, and it was approved by their the National Tribal Advisory Board for accreditation. Now, I want to just take a moment to explain sort of 3 key pieces of this definition that is really important, and its significance is based on public health authority, which I'll talk about in a second. So part of what makes a tribe eligible for accreditation is that the health department is a governance function of the tribe, and its function is to provide public health services within its jurisdiction. And that jurisdiction is defined by the tribe, whether it's reservation boundaries or if it's a checkerboard community. That jurisdiction is defined by the tribe, and the health department's function is to protect health within that jurisdiction. The second piece is the jurisdictional authority, and that means that the tribal council or the governing entity, the appropriate governing entity, has given that authority to the health department to implement those public health programs and services to protect and promote health and respond to issues and events that occur. And the third piece is that that authority is evidenced through some type of legal action by the tribe. And that could take a number of different forms. But the reason this is important is because by definition, tribes are public health authorities. And this definition comes from the Department of Health and Human Services. And the definition highlights those 3 elements that I just talked about. That public health authority is a governmental entity, which includes tribes, that it has the authority as part of its official mandate, and in particular, its jurisdiction, and it has a responsibility to address the health and health matters in their community. And the second example is when the authority is extended to another entity, as with the tribal epicenters. So the federal government has extended its authority to the tribal epicenters through the Affordable Care Act that was passed. So tribal epicenters are also public health authorities through that extension. So whether or not tribes have codified or made legal that authority, they exercise that authority every day. And we saw that firsthand with COVID. Tribes that exercise their public health authority throughout the pandemic, we know what works for our people, and we saw that across the nation in a variety of ways. So from vaccinations to contact tracing, our tribes were on the front line. And even our ability to communicate with our communities to create real change And I listened to a panel not long ago featuring the chairwoman, Lee Gatewood from the White Mountain Apache tribe. And she talked about the power of language in creating behavior change. And they had a word in their language that had more significance in meaning than just take care or be safe or protect yourself. But that word had a much deeper sort of spiritual, emotional, and physical meaning for taking heed, being watchful over yourself and taking care of yourself. And they put that word over masks. And so that ended up being something that was very effective in their community. And that these are just some examples of how tribes were responding during the pandemic. And so public health authority is important for a number of reasons, and these are just a few. But I think we understand through our experiences is that we're not always fully integrated into existing surveillance systems for public health response networks. And so being able to have that authority articulated helps build relationships with both state and local governments. It can be challenging when the federal government transfer those authorities over to the states through block grants. We know that our Native American populations are counted by the states in their grants, but then we sometimes run into issues of who's responsible for providing those services. Tribal communities can often be at increased risk due to health disparities or higher rates of morbidity that may exist. And we have to recognize that our healthcare centered services are not always prepared to respond to public health crisis. So being able to think about our public health services and activity really helps us to respond. It can improve our ability to be able to get quality data on our populations. And it's an opportunity to increase acknowledgement and respect by other governments and other stakeholders of that authority. And so when these authorities are articulated or codified or legally documented, it makes it easier to interface with local and state authorities. Public health emergencies do not know borders. A tribe may have the capacity to exercise these authorities in full, or they may not. But sovereignty is still exercised when a tribe makes the choice or the decision to grant that authority to a state or local government. So strengthening public health authority is a key benefit of accreditation because it provides a framework for assessing your current capacities against a set of standards to help identify and address those areas to improve. So here are just some of the many benefits and opportunities to pursuing public health accreditation. And no, this isn't a paid soundbite for public health accreditation, but these are the things that we see in our work with tribes and Pacific Island territories that are pursuing public health accreditation. And I've already mentioned it can be used to strengthen self-determination and authority, but it provides you with performance data that you can use to make sound decisions and identify and act upon areas for improvement and increase your performance to improve quality. And whenever we look and self-assess at our current performance and seek to do better, we can't help but strengthen our leadership and our employee performance. And through that, as we start to have conversations about the work that we're doing, we build stronger partnerships, we increase our communication and collaboration. And once awarded, accreditation can provide that recognition and validation to your tribe. And it also speaks to the accountability that a tribal public health program can have to its community. There's always the potential as an accredited department to also have increased access to resources because it speaks to your high performance. But at the end of the day, it's really all about communities. Communities are the reason we do the work that we do. So that's just a little bit of an intro to, from our perspective, about why we think public health accreditation can be useful, but also to help us think more broadly about the benefits of accreditation as it relates to our communities. So before we continue, let's take some time to talk to each other a little bit about why we're all interested in learning about accreditation. And so I'll turn it over to Teresa to lead us through a networking activity.
Thanks, Alina. So as Alina said, it really is all about community and knowing that we all carry knowledge within us and can learn from each other. We're going to break out into 2 small groups where you'll have about 8 to 10 minutes to answer some questions. I'm going to drop those into the chat. So really to get to talk to one another about what it is you hope to learn about public health accreditation, or what questions do you hope to have answered? And so first start by simply introducing yourself, go through the questions, and identify someone in the group that is willing to share out with the larger group once we come back. Before we do the breakouts, are there any questions?
No.
Thanks, Bree. I do have a little pro tip that I learned. Sometimes when you go into breakouts, people are hesitant to be like, should I go first? Do you want to go first? So let's try doing it by alphabetical according to your first name. I invite you to share first. So here we go. You should see a prompt. And we will let you know when the time is, we'll give you a 2-minute warning. See.
Should we drop the chat into the chat again to the breakout rooms?
Sure, yeah. Let's see. Michelle, are you able to access your breakout room? That's okay. She might have stepped away. So yeah, I can drop that in again and everyone should be able to see it in their room.
Okay.
I was sent to room 2, but I'm not going.
Okay.
Right?
Yes, correct.
There we go.
There we go. Okay. Do we want to pause recording or do you want to keep? Just an option.
I can go ahead and pause recording.
Name.
I love it.
Oh, a team name.
That's awesome. Very cool. Let me just check. I think we might have a couple haven't joined us back yet. They have 10 seconds and they'll be bounced back in. Here we go. All right, the team's all here, both teams. So for those of you that just joined us, I'm going to go ahead and drop in the chat. This is a link to our presentation slides in PDF form, as well as a worksheet that we're going to use later on in the presentation. So I know some of you already saw the link, and if you get a chance, just let us know if you have any issues opening either one of those links. So awesome, great. Well, I'm going to ask team 1 who came back. I'm going to ask them to share. They came up with a team name.
All right. Well, good morning, everybody. We got to have a name. I cannot remember, this early in the morning, 6 people's names. So I just said it would be a lot easier if we just have one name. And the first name that came up, Wellness Warriors. So I like that. I like that. And we've got folks from all over the country. To kind of not be too specific, but the overall we've got several of the group that were interested in just kind of some basic foundational information about what public health accreditation is and what it's all involved. And there was somebody else that had made mention on how tech fee can benefit from this and work with other tribes and tribal partners to work more closely together to further what we're trying to do. And my particular question was about the statutory authority of tribes and tribal epicenters in regard to tribal level data and the Indian Healthcare Improvement Act, the authority that it gives us within that. So, Hana, that's all I've got. Thank you.
Awesome. Thank you, Chris. So for those of you that just joined, I dropped a link in the chat with our presentation slides and a worksheet for later. And what we're doing right now is we actually broke out into 2 small groups to answer these questions. So that's what you're going to hear this next group sharing, what they discussed in their group. So group 2, take it away.
Hi, everyone. My name is Sarah. I'm a program coordinator and epidemiologist for Southern Plains Tribal Health Board. Nice to meet you all. So in our group, we discussed a little bit about how most of us just have experience with accreditation when it comes to public health programs. So almost all of us were OSU grads, go Pokes always. And so we have a little bit of work with Oklahoma State University as far as accreditation through their Masters of Public Health program. We know how that works. I've worked with Pawnee Nation College a little bit with accreditation there. So we're really wondering what this actually looks like outside the university setting, other entities. And then the other question that came up was, in these other entities, when we have this accreditation, how does that work for billing and reimbursement? Does it change any of that? I believe other than that, we all are just pretty unfamiliar. So we joined because we just want to soak it all up and learn, as this is under accreditation is a huge undertaking. So just want to have any tips there that are possible. Thank you.
Great. Thank you. Thank you both groups for engaging and chatting and really, learning from each other. It's great to connect. Before we pass it, I'm going to pass it over shortly to our next speaker, Marita Chilton, to talk more about public health accreditation and the foundational public health services. Does anyone have questions before we move forward? All right. And if you have questions, please drop them into the chat at any time. We'll be monitoring those. And I will hand it over to Marita Chilton.
Thanks, Teresa. Pull up my slides here. I'm really excited to be here with you all today. So thank you for coming and for wanting to learn. Please do throw your questions into the chat. Or if I, stumble on a topic and you really want to discuss it right away, just come off mute and shout, and we can spend a little bit more time on it. So, as Alina said, accreditation is huge. There's so much information. So I'm going to do my best to provide some overview today, and then we can dive into any areas where you might have some additional questions, or if I kind of confuse things, please do let me know. So I just kind of wanted to start by just kind of acknowledging the last couple of years and all of the lessons that we've learned during this COVID pandemic. And so there's a link here to the Public Health Forward report, and I pulled this out because I think it does really identify a lot of the challenges, just the pervasive health inequities, the mistrust and misinformation, and just a lot of things that were really illuminated over the past couple of years. And then it also kind of defines a vision for how we might modernize the public health system and a framework and some practical actions that we could take, both for public health officials and for policymakers, and just kind of how we can use it to help guide some decision making. So the report does acknowledge that the tribal health systems and tribal health departments are really critical to community health. It called out the foundational public health services as also being critical for all health departments everywhere, all types of health departments. And so I just kind of wanted to ground my presentation today in acknowledging the challenges and knowing, saying out loud that most health departments are still facing so many of those challenges, with workforce, data modernization, community mistrust, and and just all of the things that are kind of happening in the world around us, and how, I said I'm passionate about accreditation. I kind of geek out over it. And so I do see it as a framework and a blueprint for one way that, we can kind of move forward and help modernize our systems. So where does FPHAB fit? As Alina said, we launched our accreditation program in 2011. We accredited the first health department in 2013. Super excited to announce that yesterday we've let the health department know, but we haven't released the name publicly yet. So I can just say we accredited another tribal health department. So we have 6 accredited tribal health departments now. Super exciting. And FPHAB, we're really working to build trust in public health by ensuring excellence and bringing innovation up to scale. Our mission is to advance and transform public health practice by championing performance improvement, strong infrastructure, and innovation. And so in addition to being the only accrediting body for public health in the US, we're also home to several centers that contribute to innovation and transformation of public health practice. This includes the Public Health Center for Innovations, or PHNCI, which is the steward of the Essential Public Health Services model, the foundational Public Health Services framework, and is also home to the 21st Century Learning Community. We're also home to the Center for Sharing of Public Health Services, and we're incubating the Center for School Health Innovation and Quality. So this is the Foundational Public Health Services framework. What it does is it really outlines the unique responsibilities of governmental public health, and it defines a minimum set of foundational capabilities and foundational areas that must be available in every community. So earlier this year, we did revise this framework, and most notably, equity was added as an 8th foundational capability. So you might have seen the framework before that's kind of flipped on its axis. And so this image might look a little bit different, but it really was so that we could elevate equity as both a cross-cutting skill and capacity, and reinforce its critical role in ensuring community health and well-being. So the flip on the framework was really done to kind of better capture how the components work together. And then we also added in clarifications and revised some definitions to just update it. FPHAB uses this framework in most of our products and services. So it's included in accreditation, in pathways recognition, in our 21st Century Learning Community, and in all of our assessment and planning tools. And so I'll be kind of referencing this as I go through today. And I think Alina did a great job on promoting and kind of identifying why a health department might want to go through accreditation. When I'm talking to departments, I think when they ask me this question, I always say it's not about the plaque on the wall. Going through this process just to get a plaque on your wall, chances are you might not actually be successful in it, and you definitely won't get as much out of it as if you're approaching it as a way to really objectively assess your strengths and identify those areas where you can strengthen. So FPHAB accreditation, we are a lot less kind of rigid than many other accrediting bodies in that we set out the standard and we allow the health department to identify the ways that they're meeting that standard in their community for their community. It's set up to be both a reflective process along with having a peer review component to it. So we found when we've asked health departments that have gone through it, kind of, what are the benefits? They've told us it not only strengthens their operations, but it has an impact on the community and ultimately on those community health outcomes. Accreditation promotes public trust, and it demonstrates a commitment to quality and performance improvement to better serve communities. I was looking back through some of our survey data before this today and saw that more than 80% of accredited departments indicated that overall accreditation has helped them in their response to the COVID-19 pandemic. And we have a lot of survey data, so I pulled out some of those benefits that kind of rose to the top, which include increased accountability and transparency, strengthening relationships with key partners, helping health departments use health equity as a lens for identifying and addressing health priorities, and improving the health department's ability to identify and address gaps in employee training and workforce development. So I'm going to spend a little bit of time talking about our version 2022, which is the set of standards and measures that we've released in February of this year. And, towards FPHAB's mission, version 2022, it sets forth an actionable blueprint for health departments that can be used, whether you go through the full accreditation process or not, I really believe that the standards and measures can be used as that kind of blueprint or framework, just as you're thinking about the different parts of a health department and the different ways that you're approaching the community. We developed the version using a transparent and systematic approach, which really considered the environment that health departments are currently operating in. It supports rebuilding public health infrastructure and workforce, works to operationalize and create alignment across the essential public health services and the foundational public health services frameworks. And it really strives to leverage what we've learned from the past several years. So a little bit more about how we got to version 2022. So it was a multi-year journey that we started back in 2017. So both initial and reaccreditation versions were informed by recommendations from a lot of different inputs. So we used psychometrics, content analysis, commissioned papers, expert panels, think tanks, and FPHAB's Accreditation Improvement Committee, which is made up of public health leaders and practitioners, oversees the entire revision process. And we do have tribal representation on that committee. And then we also had tribal representation on several of the think tanks that we held. And then FPHAB, because we did really want to make sure, we had done a lot of work very early on with the tribal feasibility studies and other things. And so we wanted to make sure that there was also a very large presence in this revision process as well. So with assistance from and in collaboration with the National Indian Health Board, we worked to solicit tribal input and feedback into the development by having convening a tribal accreditation work group. So between October and December of 2020, we worked with this work group to provide, they gave us high level as well as detailed feedback on different topics and aspects of the program. So we went through each of our think tank report summaries with this work group and had them provide recommendations on each of the different topic areas from that tribal perspective. And then the work group presented their feedback to the National Indian Health Board's Tribal Public Health Accreditation Advisory Board in December of 2020 for additional discussion. Throughout the entire revision process, we sought feedback from the field and partners, and that included an 8-week public vetting process. And then we extended that vetting process for tribal health departments that have either gone through or are currently in the accreditation program to hear from them, and NIHB hosted an additional learning session where feedback was shared, and then we used that in the final versions. So as I said, we released these in February of 2022, and they're currently in effect. So I won't spend time right now going through each of these recommendations, but I did want to note what the 6 high-level recommendations from the tribal work group were. They also give us so many measure level and topic suggestions, but as I go through these next slides, I'm going to pull out each of these recommendations and kind of talk about how we integrated them into the final revision. So just kind of at a high level, version 2022 incorporates key lessons from practice. We worked to reflect the current aspirations of the field while not raising the bar too high. So FPHAB accreditation for health departments is not set at a gold standard. It's also not a minimum level. We aim to be right in the middle, and we aim to help health departments improve and push them up to that middle. We are later this year continuing to work on an excellence program for accredited departments that want to push even further, but we really aim for our standards to be at that kind of midpoint. Equity is a theme that's infused throughout version 2022. So equity concepts are interwoven throughout the requirements and are in each of our 10 domains. We made significant changes to preparedness requirements, since we've learned a lot about that in the last couple of years. And we really worked to align our preparedness requirements with other reporting requirements health departments might have, either through NHA's Project Public Health Ready or CDC's Operational Readiness Review for the Public Health Emergency Preparedness Grantees, or those FPHS grantees. We really worked to clarify our requirements, focus on meeting the intent of the measure rather than on documenting it. So where possible, we wanted to reduce duplicate documents, we wanted to streamline the requirements, and just overall reduce any documentation burden. And we worked to promote accountability. So we feel that stakeholders should feel confident that accredited health departments possess key capacities. And so for that reason, version 2022 identifies specific measures as foundational capability measures. And so you'll see here, and you'll hear me reference these foundational capabilities a lot today. And in the previous version, in our version 1.5, we did include the foundational capabilities, but they were kind of spread throughout and a sub element here and a requirement there. And we had a very confusing crosswalk that no one really referenced because it wasn't very, it was not clear. So for version 2022, what you'll see here on the screen, this image, this is our new crosswalk. So it is very clear. We have 34 measures that are the foundational capability measures. And we think that this really helps kind of align the tools and the frameworks and allows health departments that are interested in meeting the foundational capabilities to be able to pull those out and see what they are and focus on those if that's what they're wanting to do. One of those recommendations that you saw on the previous slide was to streamline the standards and measures with the focus on meeting the intent of the measure. And that was one of our expressed goals going into this. We really wanted to reduce that documentation burden. So in this bar chart, you can see a count comparison between version 1.5 and version 2022, kind of starting at the front with the domain, the standard, the measure, the RD, and then where it really matters for the applicant, the number of required documents that they need to submit. So we were able to consolidate many of those requirements, and in total, it's about 90 fewer documents that are required in version 2022. Another one of the recommendations was to consolidate the requirements in one section to improve readability and clarify kind of throughout. And another one of the recommendations was to add more guidance and examples. And so that's one of the significant changes that we did make. So in that dark gray bar on the left, you can see that all of the requirements are identified in one place now. So that really, we think, improves readability. We added a lot of guidance, noting the intent of the requirement with additional examples. This screenshot, I had to sort through to find one that would fit on a page. So this example doesn't have as much guidance as most of our measures do, but we really worked to try to come up with so many ways that health departments could meet the measure, and just identify different things that a health department might want to consider in their community as they're kind of doing this work. We also work to increase alignment between our initial accreditation and reaccreditation programs, particularly on major plans, so that health departments could have a better line of sight for how they're improving and the changes that are happening in their communities. And then we realized that no two health departments are the same. So we added in some not applicable requirements just because of those mandated responsibilities. It's not the same state to state or tribal health department to tribal health department. And so we wanted to allow for more flexibility. And so for in this example, if a health department doesn't have enforcement authority, they don't need to submit documentation for this measure because it just wouldn't be applicable to them. Another recommendation was around language clarification. It was suggested that the definitions of jurisdiction and community should be clarified and that additional terms be added to the glossary. It was also suggested that language around sovereignty needed to be incorporated in the standards and measures. So within domains 1 and 5, which is where your community health assessment and community health improvement plan live, we added language to try to clarify what a community means related to those plans. And we noted in there that it's the tribal health department that defines who their community is. So we have some examples of what it might be. Might be all of the residents residing within the tribe's jurisdictional area, might be tribal residents residing within the tribe's jurisdictional area, or it might be the tribal population as defined under tribal sovereignty, or it might be something else. The tribal health department will get to tell FPHAB what their community is to them. And then also in recognition of tribal data sovereignty, there are several places in many of the measures that explicitly indicate that the tribal health department applicant can provide alternative documentation. So for example, tribal health departments are not required to post their community health assessments online. We recognize that as a data sovereignty issue. And so if you don't post it online, then you can just let FPHAB know who you shared that data with and how you shared it. There are also we have several measures in our standards of measures that are for state health departments only. And we really did a deliberate shift in focus that to demonstrate that the state support to tribal and local health departments is being responsive to their needs. So rather than making this assumption that the state health department inherently knows what local and tribal health departments need, the requirements are framed around the state first asking for and receiving feedback from local and tribal health departments about their needs. And then the state health department needs to show how they're being responsive to that feedback. So the requirement also, it was a great suggestion that we got from the work group to reframe how we were thinking about technical assistance. And so we shifted focus here also to allow for examples such as being the coordinator of calls of learning communities or working with health departments to share best practices. So those green boxes there are the state measures showing where the state has to provide assistance. But the aim of these is really that the state, tribal, and local health departments are better coordinating and ensuring that the support that's provided will be useful, and recognition of tribal sovereignty is being considered in those communications and decision making. So I mentioned that equity is woven throughout version 2022, and here are a couple of examples that come from the standards and measures. So thinking about disaggregating and analyzing data to really understand disproportionate risks are included in several places, and I have a couple of them here in these examples. Looking at cultural humility in communications, both with your risk communications as well as with your general health communications and those day-to-day efforts. Engaging with the community, both through partnerships and how the health department interacts with community members while providing services to the community and ensuring that equity is at the center of all of that. So one of the questions that I sometimes get is asking if version 2022 still requires that applicants are looking at subsections of the populations when thinking about equity issues, or if the entire tribal population can be identified as that group that faces inequities. And the answers would be both. So there are some measures where we broadened the requirement, where a tribal health department might say that it is addressing equity for the entire community, and others where we continue to ask that even within your community that you take a look and you identify those subpopulations and that you're working towards identifying equity issues faced by those most vulnerable groups in your community. So what is FPHAB's scope of authority? What do we cover? What are we kind of including in our accreditation? In March of 2021, we did update our scope of authority and we really broadened it. The revision allowed health departments to showcase more of the services and the interventions they provide to improve that population health. So we're still really focused on the health of the population, but we broadened our definition to be able to include more of the subgroups and more of the work that the health departments do on a day-to-day basis. So on our website, we have this full policy, and it includes an addendum with a lot of acceptable and not acceptable examples organized by topic area. So if you are starting to really dive into the accreditation world, I'd encourage you to take a look at this and look at some of those examples. But really simply at kind of a high level, populations are comprised of individuals. But FPHAB does not accept documentation examples that are delivered at that individual or single family level. Instead, documentation has to illustrate that the health department uses data, policies, systems, programs, or services to collaboratively improve the health of the population, address social determinants of health, and facilitate health equity. So I find that examples are usually most helpful when thinking about the scope of what FPHAB covers. So for example, for some other accrediting agencies, you might need to provide case files or individual reports, things like that. But for FPHAB, if we're thinking about a health department, say that operates a dental clinic, that document of a patient file showing that they put sealant on a patient, that can't be used for FPHAB. That's individual level, that's clinical, and so it's outside of our scope of authority because there are other accrediting bodies that do that. Instead, what we're looking at is that population group. So if you operate a dental clinic, your documentation might be looking at the rate of patients that came month by month or year by year to show that you're, being responsive to your community and you're addressing those needs. Or they might, that documentation might be how you promoted the dental clinic to families with school-age children or other vulnerable populations that most need those services. And so I know there was a question earlier about kind of that reimbursement piece. And so that's really outside of FPHAB scope. That is looking at that individual clinical piece of things that's covered by other accrediting bodies. And what we're really focused in on is, what is the health department doing to be able to improve the health of their population as a whole, and then those subpopulation groups that are that make up the community. And then one last thing about version 2022 and kind of FPHAB in general. So we, I think we've talked a lot about how the health department is a key part of that public health system. And that system is really important to its community. And so that focus of the FPHAB standards and measures is that the health department ensures that those services and activities are provided to the population, but FPHAB isn't concerned with who provides the services and activities. We want to make sure that the health department is ensuring that they're being done, but we don't expect for one entity, one health department to be able to provide them across an entire community. So for FPHAB accreditation, health departments can use documentation that's created by someone else. And thinking about internal operations, an HR might be countywide. And so the health department, that's fine. They could use the county's health HR system. Or maybe a partner in your community or a neighboring county is the lead on an initiative in, where your community is participating in it. And it's fine if the health department is one of many partners that's part of an activity, or if the health department is using documentation that was created by someone else. We really want to see the document's relevancy to the health department. So how did the health department contribute to the initiative or program, or use the documentation with their community, or how is it just kind of what's the relevancy to community health? So a couple of our requirements do indicate that formal agreements are required. So if you're looking at the standards and measures and you see that an MOU or an agreement is required, if it's not done directly by the health department, then in those cases we would need formal partnerships in place. We are strategic in thinking about where those are really important for the work that communities do. But for any of our measures, for most of them, where we don't specify that formal agreement is needed, it's really about kind kind of showing how the work is done in the community, and a health department going through this process can just provide that contextual information to FPHAB as they provide their examples. And so we don't need formal agreements for all of the work that's done. And then we do have a lot of many measures that require that partnership. So we require that a health department is showing how they're working with others, how they're going through the kind of their services and interventions in a collaborative way. So just as one example, the community health assessment, needs to involve various sectors of a community, because we don't think that should be done in a silo. So we'll talk more about partnerships as we go through today. Now I want to shift just a little bit to talk about our Pathways program, which is something that we recently launched just in July of this year. And our purpose of Pathways is really addressing that recommendation about small and rural health departments and keeping them in mind and providing a way for them to approach the accreditation program in a way that works for them. So it supports performance improvement, it strengthens infrastructure, and it facilitates transformation. Pathways can serve as a performance improvement milestone. So it might be what a health department chooses to go for. We think that's great. Or it could facilitate accreditation readiness. So it is also designed to be a way that health departments can kind of step through the accreditation program in a more bite-sized way. So the Pathways Recognition Program is not accreditation, it's a recognition program, but it can lead you towards accreditation. And what we did is in version 2022, there are 34 foundational capability measures. And we took those 34 and we broke them into 2 tracks. So track 1 is services and partnerships, and that really comes from our domains 1 through 7 and includes 19 measures. And these are the foundational capability areas around assessment, surveillance, partnership, policy, preparedness, communications. And track 2 is looking at health department systems. This is from domains 8 through 10 and includes 15 measures. So it focuses on organizational competencies and accountability and performance management. Well, it's a shorter list of foundational capabilities. The one focused on organizational competencies has a large number of components, and those measures include requirements around workforce, strategic planning, financial management, all of those different areas. And then you can see equity there in both of the tracks. So similar to how equity is infused throughout all of the domains, we did include it in both of these. And so as a health department, if you aren't quite ready to go into full accreditation, you might choose to do Pathways recognition, and you could choose to do track 1 first, track 2 first. You could do both tracks at the same time. You one and that's it, or you can go through one and then progress to the other one and then go up through accreditation. So we really tried to design a program that would be flexible, that would meet the needs of health departments, and kind of provide some different ways that health departments could improve their systems in the areas where they were most interested in going through and improving. We do have some incentives for accreditation. We believe that every health department in the United States should be an accredited department. We want every member of those communities to be served by an accredited department. And so if you're applying for accreditation within 2 years of completing Pathways recognitions, any assessment that you get that's largely or fully demonstrated carries through to accreditation. So for those measures, if you go through and you've demonstrated all 34 of those measures, then when you go into accreditation, you don't have to be reassessed. You don't have to submit additional documentation. So it really streamlines that process. If you demonstrate conformity with all measures in a track, we'll give you a discount for accreditation. And if you receive Pathways recognition, which is conformity with all measures in both tracks will give you a larger discount for accreditation. So I'm happy to talk more about pathways. And I have one more piece before I pause for questions, unless someone comes off mute and shouts at me and has a burning issue. And this last piece is just kind of walking through the 10 domains. I'm going to spend a minute or less on each. So it's really, I'm speed dating through the domains here today. If you're looking at going through accreditation, I do encourage you to really take a deeper dive into the standards and measures. Know that you can ask FPHAB questions at any time. We have a whole team of accreditation specialists that are, very happy to hop on phone calls and just talk about any of the domains that you're interested in. We all tend to geek out about this stuff. And so we're always happy to have those calls with interested health departments that just kind of want to learn more, explore something in a little bit more detail than we're able to do in these broader sessions. So we have the 10 essential public health services wheel here. I just kind of like to start with this one, thinking about the standards and measures, because we do, our 10 domains are based on the 10 essential public health services framework. And so you'll even see as I go through these next slides that our domains are color coordinated to match the wheel also. And so you can kind of see that thread throughout. All right. So, and as we walk through each domain, the image there on the right, again, is the foundational public health services model. So I'm going to briefly say what the domain is about and highlight the foundational capability that is included in each of the domains. So with domain 1, we have about assessing and monitoring population health status and the factors that influence the health of your community. So this is focused on your community health assessment, the collection of non-surveillance data, sharing of those data, and then the data analysis and use. So as part of domain 1, there are 4 measures that are considered foundational capability measures, and all of those are within the assessment and surveillance bucket. Domain 2, we're focused on surveillance, investigation, containment, and mitigation, as well as those emergency preparedness and response. This domain includes requirements that promote health equity by addressing efforts that prevent inequities from containment or mitigation strategies. So this is including your public health emergency plan, your COOP, your risk communications plan, and the foundational capability measures in this domain include those related to assessment and surveillance, communications, and then of course your emergency preparedness and response.
So Marita, we had, sorry to interrupt, we just had a question. I think, Zachary, I'm not sure if it was a question for domain or domain 2, but it was a question about the diagram in domain 1. Okay, how is data collected? Who collects the data and how is it shared typically? How would you respond to that question?
Yeah, that's a great question. And thank you for stopping me. I didn't see the chat. It's on my other screen, so I didn't see that we had any chats coming in. So really with domain 1, it is grounded in that community health assessment. So if you're looking at the measures, that is the very first one there. And a community health assessment, it's really intended to, collect data from lots of different sources. So it's primary data from either the health department or from that community partnership that's pulling in primary data. It's looking at secondary data from, as many sources as you can find it and you have time to look at and analyze, and putting it all together to really look at what does health look like in our community and what are the health stats in our community. And then in domain 5, you'll see a thread where the community health improvement plan uses that data to make the plan. But domain 1's really just focused on that assessment of the data. And then we have some measures around the sharing of data and looking at both sharing within your community and within those community partners, and to community members, as well as looking at sharing across systems. So it might be sharing with the state health department, it might be the state health department sharing data back with the tribal health department, and really making sure that there's that kind of two-way road so that we can have better systems in place and that we can build those systems up. And so the standards and measures give a lot of options for how that data sharing can take place, because we know that health departments are in different places. And we also really want to make sure that we're respecting tribal sovereignty, especially when dealing with tribal health departments in this data sharing space. And then, okay, I think that might have been your question, but Alina, do you have anything that you'd want to add on to that, or Zachary, if there's a follow-up?
Well, I'll just add that, well, I'll make a plug, a shameless plug, but we're doing a training as part of this training summit. We'll be doing a community health assessment training tomorrow at exactly the same time as we did today. So 10 a.m. Central, 9 a.m. Mountain, and we'll be going into more details on all of the different things that Marita just touched on for community health assessment. How data is collected, who collects the data, and how it's shared. We're going to be talking about all of those things, as well as about how community health assessment as a process can help build relationships across that system, and to tell that story about health. So in that sense, electronic health records absolutely can be used as part of that data. And I strongly encourage, and one of the questions that often comes up when we're working with tribes who are doing community health assessments, they might say, well, we've got electronic health records, but not for our entire community. There's just a service population, those who access care within our community. Remember, Marita was talking about how you define community. And so the electronic health records might, just like I said, represent a portion of that, but that's still an important part of the story that you're telling about your overall community. So you can say, we serve about X% of that community. And based on that, here are the rates of diabetes, other chronic diseases or screenings, for prevention that kind of help tell that story. So we'll talk about that more tomorrow in detail if there's interest. I believe there's still opportunity and time to register for that. So great. Any other questions on that before Marita goes on to the other domains? And thanks for your question. And again, everyone, just feel free to drop them in the chat as we go. We'll have time at the end for question and answer as well, but it's always helpful to also answer it while we're talking about it. And we have the time today, so.
Absolutely. And Alina, jump in again. I think it's
Okay.
hard. I'm gonna miss more chats if they come in while I have my slides being shared. So yeah, please jump in if there are additional questions. All right. So then we have our domain 2, our emergency preparedness, and then we go to domain 3. And this is really looking at all of those non-emergency communications and looking at how a health department is providing information on public health issues and public health functions through different communication methods to different audiences, and using those health communication strategies to support prevention, health, and well-being. So again, similar to the other domains and things that we've talked about, there'll be a requirement, saying, to use different communication methods to reach a subpopulation. But then based on your community, it's really you looking at, okay, well, what are those messages that are most important to get out? How do our community members receive information? And so what are the best ways that we can communicate with them, whether it's on social media or website or PSAs or flyers handed out, at health fairs, and then showing kind of how you do that. So the foundational capability area that two of the measures fall into are both in that communications bucket. So domain 4 focuses on collaborations. So this is really about how the department's working with their partners and how they're engaging with the community. It's about taking an established relationship that you already have in place and then demonstrating how you've been building on that relationship to engage in a collaborative activity that addresses the health of your population. And not surprising, the foundational public health services area that we're addressing in this domain relates to community partnership development. And then we get to domain 5, where we're focused on reviewing and improvement of laws and policies, looking at the community health improvement plan and efforts to address factors that contribute to health inequities. So the foundational capability measures here address the requirements for community partnership development. So when you're looking at the adoption of that community health improvement plan and how you worked with your community to do that assessment first, working with partners, gathering lots of data, and then using that again through partnership to develop a health improvement plan that can be used, to really move forward and advance the health and well-being of everyone in your community and kind of looking at the whole person there. Related to the foundational capability bucket around equity, we have a measure in domain 5 that addresses factors that contribute to specific populations' higher health risks and poorer health outcomes. So this is where we start to look at those subpopulations in the community and looking at who is kind of most vulnerable in different areas. And then domain 5, we also have a measure around the health department needing to examine and contribute to improving policies and laws as part of the foundational capability that addresses policy development and support. And FPHAB has a very broad definition of law. So we include any ordinances, regulations, things like that, as well as how you might more like laws as you think about like big laws. So we're
like
looking at
sanitation, food handling, things like that, water quality set.
Exactly. And so if you're looking at those policies and laws, whether they are the big, food code and you're revising that, or it might be looking at maybe some of the COVID ordinances that you put into place and how you're looking at that. And you're making sure that when you're doing any of this work, that you have that equity lens and that you're thinking about the different populations that are going to be affected by that policy or law. And then in domain 6, it's focused on efforts to improve compliance with public health regulations. This is including the investigations of complaints, investigations, enforcement actions. And again, here with equity, part of improving compliance really includes considering cultural humility and cultural literacy when communicating with those regulated entities about their responsibility, when thinking about communicating with the public about what actions they should or shouldn't take based on enforcement activities, and really working more towards a collaborative compliance rather than only looking at those enforcement actions that could be taken based on those laws. So it's really helping to promote the community to want to be in compliance with public health regulations rather than only using the enforcement arm, because we know that collaborative compliance can just result in better utilization rates than if only enforcement actions are taken. We do one foundational capability measure in domain 6, which relates to conducting enforcement actions. But since we know that not all health departments have enforcement authority, that is only applicable to those that have the mandated responsibility. And domain 7 includes an assessment of healthcare service availability. So really looking across your system to see, what community members have access to, where there are gaps, where there need to be strategies developed to address access to care issues. Domain 7 is looking, because we know health departments aren't the ones that are always providing all of the services. And so it's looking for how are you engaging with your partners in the healthcare system to kind of assess and improve the service availability? And how is the health department helping to be that connector to the population it serves with those services in order to support the whole person? And here we have a measure about community partnership development that is a foundational capability measure, and it's looking at how the health department is collaborating with other sectors to improve access to social services or to integrate social service and healthcare. So kind of what efforts are being undertaken that look at more than just the physical health of the person, but also take into account those other pieces that we know are really critical to the health of the whole community. And then in domain 8, we have all about kind of your workforce. So includes recruitment and retention of the workforce development, and we have a big emphasis in this domain around diversity, equity, and inclusion. So we have some requirements in there around having an inclusive culture as part of a supportive work environment of the health department, and an assessment of staff satisfaction, and then using that staff satisfaction to actually make improvements in health departments. We have 3 measures that are foundational capability in domain 8, and these all are around organizational competencies and are really looking at how you're recruiting a qualified and diverse health department workforce, developing that workforce development plan, and also providing professional and career development opportunities for health department staff. Domain 9 has 2 different standards. One is focused on performance management and quality improvement. And then a second standard is addressing the use and development of research, evidence, and practice-based insights. So this domain includes requirements related to conducting an evaluation of a process, a program, or an intervention. So, you could look at, evaluating your diabetes program, and then, what you're doing with the results of that. The domain also includes a requirement that's kind of new to FPHAB that we're really working to promote, and that's around fostering innovation, skills, practices, and processes. So, what efforts are being taken in the health department to either teach staff about innovation efforts, or using different innovative practices, or putting in place a new innovative process, or sharing that then, I think one of the really important pieces to innovation is not just that health departments are doing it, but then after you do something new that you're seeing that works in your community, that you're taking steps to then share it out more broadly, and so others can also benefit from that. So the foundational capability areas in domain 9, we have accountability and performance management in 3 of the different measures in this domain. And then domain 10 focuses on administration, management, and governance. The requirements around information security are found in here, and are really important to kind of strengthen, especially now we know there's a lot of information security risks, and that's a place where governmental public health is just a little bit behind where other industries are. And so we are really pushing to strengthen that areas. Governance has really been clarified in version 2022. Our previous version was a little bit more strict about who the governing entity was. And so we want to, we said, you have to pick one if you had multiple. And so we wanted to broaden that and acknowledge that some health departments have multiple governing entities. And if that's what works best for them, then that works. We found that in some health departments, having those different layers can really be beneficial for a health department, having both kind of governing boards and advisory boards, and looking at different ways that might be organized is very community driven. And so we want to make sure that health departments are able to do that. And so this domain, we have a few measures that include communicating with the governing entity, orienting them. But then throughout the other 9 domains, we also have places in there where we're asking for the demonstration that other topics have also been communicated with that governing entity. Also in domain 10, we have the strategic plan and the work that goes around that. And then I mentioned administration and management, like 2 words on the screen, but there are so many different requirements related to those. And so and as I mentioned, when we were looking at the pathways slide, there are several foundational capability measures related to these areas. So thinking about a human resources function, supporting programs and operations through that information management infrastructure, protecting information and data systems through security and confidentiality policies, thinking about the grants and the contracts and the financial systems is another area that's included in here. And then also the access and use of legal services is another measure that's included in this domain. Whew, that was my speed dating of the FPHAB domains. I'll stop my screen share so that I can see everyone. Ask if there are any questions or things that folks would like to discuss today.
Yeah, so we'd like to invite everyone to turn on your camera if you'd like, so we can, can be a little bit more conversational as we're in the question and answer. And like we said, you can put your question into the chat, or you're welcome to just speak out. But one question I wanted to ask as people are kind of pulling their thoughts together and things, because it's a lot of information, and and we saw from the poll in the beginning that the majority of people are new to accreditation, so they don't necessarily know a lot. But for those that might have been somewhat familiar, we know we've had, since the beginning of accreditation, we had this narrative around the 3 prerequisites. Do your community health assessment, your community health improvement plan, and your strategic plan as being kind of the first things that a health department might want to work on as part of the readiness checklist. And I know we're talking about readiness when we come back from lunch, so I don't want to jump the gun or steal your thunder from that. But as I was listening to the overview of the domains, we have the community health assessment in domain 1 and the community health improvement plan in domain 5, which was part of the first track of the recognition program. But then we have the strategic plan in domain 10, which is track 2. So if you have a health department that might be thinking, oh, let's do track 1, get that recognition, then do track 2, get that recognition, and then do then move to accreditation. And I might even be saying that wrong. Kind of, how are you talking about those prerequisites now under version 22? I guess is what I would say.
That's a great question. And I think what we've learned from the past decade is that we want to meet health departments where they are, and that people start in different places, and what works for one community might not be the best starting place for another community. And so, and I'll talk about this a little bit after lunch, but before you even decide what track you think you want to do, we have a readiness assessment that we'll have you take, and we'll give you feedback. And so you'll be able to look across, you can either just do the 34 foundational capability measures, or you can do all of the measures to assess your readiness. And FPHAB will provide some guidance and some tips. Don't have to take them, but we're wanting to provide some of that more individualized kind of feedback for, okay, well, it looks like, you have your your CHA and your CHIP done. And so maybe you are ready to start Pathways Track 1. But at the same time that you're doing that, you might want to think about also working on a department strategic plan, because we see that as a major gap, and it might take you more than a year to go through that process. And so we want to be able to give a little bit more individualized feedback in a way that we haven't been able to in the past. And we also, when we first started and launched back in 2011, it was all about those 3 prerequisites. And we were convinced that we knew the order that they needed to happen in. And as we've taken a step back and learned a lot from health departments around the country, we've really seen that, sometimes it needs to start with that organizational capacity, and that work needs to be built up before any of the others do. Or, maybe even taking a step further back, if there aren't strong community partnerships already in place, you probably won't be successful at your assessment and then your plan. And so start there. And so we've really taken a bit more of a flexible approach from where we started. We've learned a lot. It's one thing I'll say, I love FPHAB. I have been at FPHAB since we launched, because we're a learning organization and because we are so interested in hearing feedback from the field about what works for public health in public health. And we're very committed to that as one of our kind of keystones for who we are.
So I know we'll talk about that a little bit more too after lunch, when we go into readiness, which is like, okay, I'm interested. What do I need to do to get ready? We'll be talking about that. We have another question around whether an urban Indian organization will meet the criteria to apply for accreditation. And thanks for that question, Michelle. We did touch on it a little bit in the beginning of the presentation, but I'm going to let FPHAB speak to that first. I spoke to it in the development of accreditation and kind of the thinking behind that initially, but I'd like to give Marita an opportunity to respond to that question, and then I can elaborate if needed.
Yeah, so unfortunately, no, we don't currently accredit the urban Indian organizations. Right now, FPHAB is only our definition and our eligibility criteria are set up for governmental public health entities. And so since an urban Indian organization doesn't meet our current definition, we don't have that set up in place, and our standards and measures don't address all of the things that urban Indian organizations do. And they include some things that we know aren't typically done by the majority of urban Indian organizations. And so that's kind of the reason why at this point in time, we don't. That said, I think that there are pieces and parts of the standards and measures that absolutely apply. And so when I've had these conversations with different organizations, if there is value in the standards and measures, then I encourage people to use the framework and use it as a guide where it's applicable. And so even though we can't have you go through the entire accreditation process right now, we do have all of our standards and measures materials available for public use for exactly this type of reason, because we want people to be using them as a framework as it fits best. And one thing that we haven't really explored yet, but I think we're open to, is I mentioned that readiness assessment, and I'll talk about it after lunch some more. But I think that if there was an entity that wanted to do that readiness assessment, even if they don't meet our eligibility criteria for the accreditation program, that would be open to having them go through that process, and at least then to help start to identify some of those gaps or areas that they might want to think about in the future. Alina.
I think you did a great job. I think, yeah. So I don't know, Michelle, if you have a follow-up question to that, or if you feel satisfied or have.
I don't know that I have. Thank you, by the way, for your responses. I appreciate you specifically addressing. I don't know that I have a additional follow-up for this, other than it. I work with the Oklahoma City Indian Clinic, and as you were going through the domains, I was like, yep, we're doing it. The only thing we don't do are law. We do policy, we do, community partnerships, community assessments. And so I would certainly entertain and encourage discussions that would expand the criteria to include urban Indian organizations.
Thank you for that. And it's great feedback to hear kind of what you are doing and those areas where you aren't. And yes, we are also open to exploring that as we go through. So I will drop my email in the chat, and if you want to reach out, I'm happy to set up a call and we can kind of talk more. And I'd be very interested in learning more about all the work that you are doing.
Thanks, Marita.
Does anybody else have any more questions? Marita's just dropped her email in the chat for anyone who wants to contact her directly. I don't want to jump you too fast, but there was a comment that was made in the very early part around cost reimbursement, third-party billing, and how does that relate to public health accreditation? And I think that's a question that often comes up, or that people want to see the connection between public health accreditation and other accreditations where there's third-party billing and cost reimbursement for services. And especially when you're trying to get leadership on board, we're always thinking about how do we get reimbursed, for costs and whatnot. And for public health accreditation, it's really different because there's no cost reimbursement, set up in that. And so, Marita, what is FPHAB's response to that?
Yeah, so as you said, we're really focused a little bit differently. So other accrediting bodies are focused on that individual where there would be the cost reimbursement. And for FPHAB, we're looking at your community and your sub-communities that are part of that and how well the health department is being responsive to them. FPHAB is actively working to get accredited health departments more more tangible benefits. And so I think that that's been one of the challenges in the past 10 years is that, accredited health departments, they give a lot of feedback about the benefits that they've had for their organization, just in terms of improved efficiencies and transparency and partnerships and all of those pieces that are so important. But then we've also heard, and that's great for the health department and they see it. But when they're talking to those, to the governing entity or to decision makers and leadership, they want to know, well, what benefits do we get that are in terms of money or reduced reporting requirements? And so that's one area where FPHAB is continuing to work, and we will continue to work. One of the things that we were successful in with version 2022 is for any entities that are the FEP grantees for the public health emergency, CDC's reporting requirement around that. We were able to have a reciprocity agreement with CDC. So accredited health departments no longer have to report on capability 13 with that reporting. And we have opened that door now, and we are continuing to push with CDC and with other federal agencies to reduce the reporting requirements for accredited health departments. So I know we're just finishing up a strategic plan now for FPHAB. And I know that's one of our priorities is to really keep pushing that door, as well as getting accredited health departments increased funding.
And I think that's an issue for public health across the board is helping people understand that it's an investment and investing in promoting and protecting our health, that ideally we would see a return on that investment down the road and reduce healthcare costs, quality of care, and all of those different things. So it is a different framework than what we're accustomed to in our clinical settings. We have time for maybe one more question before we talk about what we'll be doing after lunch. Any other questions? Looks like we might have one coming in. Did you have a question, Talia? Or are you just joining? Okay. We'll go ahead and wrap up. Teresa, you want to?
Sure, yeah.
Paris for after lunch?
Yeah, so after lunch, we are going to work in small groups again. We actually are going to use that worksheet that I sent in the beginning, and I'll drop that link again. We're going to break for lunch for an hour, but the Zoom, correct me if I'm wrong, Mary Frances, but I believe the Zoom room will remain open. So there's no need to log off and log back in. So just feel free to mute yourself and turn off your camera. The team here will be back on. The Red Star team will be back on about 10 minutes before the hour in case anyone, wanted to ask a one-on-one individual question. And so, yeah, I think that's it. Enjoy your lunch. Get hydrated. Take a screen break.
And I'll just add that, so we'll be returning, we'll be starting promptly at, is it 1 p.m. Central? I'm on Mountain Time, so I just want to make sure I say that right. Yep. 1 p.m. Central. And our focus is going to be on readiness for accreditation. We'll be talking about strategies and resources, as well as the 7 steps to accreditation. So providing a little bit more context to the readiness assessment that we've been talking about. And also how those prerequisites, which I kind of jumped ahead on, are framed within the foundational capability measures. And as Teresa said, we'll break into small groups and really start to dig into the 10 essential services and what they look like in your community. So we'll be doing more small group interaction. So hopefully that'll be enough incentive for you all to come back. I know you're all very busy as we kind of roll up our sleeves a bit more and get into some of the more substantial aspects of public health accreditation. So with that, we'll see you all at 1 p.m. Central, 12 p.m. Mountain, 11 a.m. Pacific.
Mhm.
I'll go ahead and
Thanks,
stop
everyone.
recording. Thank you.
Services. She went more in depth into the 10 domains. And that is where we left off. We also had a little bit of time in breakouts for folks to talk to each other and learn from each other about what questions they have about public health accreditation. And then we broke for lunch, knowing that coming back, now we're going to really roll up our sleeves, as Alina says, and talk about readiness. So any questions, any lingering questions from the first half? No? Okay, awesome. Well, I will turn it back over.
So we'll go ahead and turn it over to you, Marita, to talk about readiness. And I invite anybody to send questions through the chat at any point in time, and we'll sort of weave those into the presentation. And then we'll also have time for question and answer afterwards as well.
Yeah, absolutely. Send those questions in. I know that I threw a lot of people in the hour that I feel like I talked so much. So please do have your questions, and I'm excited for this next step where after I talk a little bit more, we'll actually have time to do roll up our sleeves and do a group activity where you'll get to really think about some of the stuff that we've been talking about today as it applies to your community. So kind of think about if you're interested in accreditation and how to get started. I'm going to spend most of the time I talk in this next section talking about those early stages and the preparation and everything. But before I get to that, I do want to just kind of briefly walk through the accreditation process and kind of put it in context for how it goes. FPHAB really wants health departments to be successful when they go through the accreditation process. And we do think that a big part of that is that preparation, and so much of it happens before you ever actually apply for the accreditation program. And so that's why we have such an emphasis on those pre-application steps of the process, where we have a live training and access to on-demand trainings and that readiness assessment that I keep referencing and we'll dive into in a minute. And so, it's a really important part of the entire process that you go through. And after you do that preparation, that's when you actually will decide, okay, do I want to go through initial accreditation? Do I want to start with pathways? If I want to start with pathways, which track is kind of best one for me? And you'll make that selection, and you'll fill out a brief application letting us know what you want to do. After that application, then you go through your documentation selection and submission process. So you'll actually provide all of those documents to FPHAB in our information system, and you'll upload them, and we have documentation cover sheets also that you'll use to help kind of provide context and let us know, as the reviewers, what are we looking at? How does this, how's it relevant to your community? And then you move into the review step. So once you have all your documentation uploaded, submit it to FPHAB, and then we start our review. And there's multiple steps in this process. Both accreditation and pathways have a review by FPHAB staff of the documentation first, and we'll come back and we'll open up any questions and ask you for additional documentation if there are measures where the intent of the measure is not yet being met. So we'll ask you to provide a little bit more. During this time, you can still be creating documents, updating them. If we flag something saying, your policy's outside of the 5-year time frame, during this reopened step, you'll have some time to say, oh, well, we can do that. We can tackle that in 45 days. And so you can do that review of the policy and then provide an updated one, so that you can, get credit for the great work that you're doing. And that's where the two tracks then change a little bit, or two paths change. So after that initial review and we get your reopens, for pathways, then we engage those peer reviewers, the site visit team, and they do a final review of your documentation, and there's a determination made then based on that assessment. So it's kind of a shorter process, because it's a more limited scope of measures, and it's a recognition process. For accreditation, after you reply to the additional measures, then that site visit team gets started. They review those additional documents. They review all of those foundational measures and anything where FPHAB flagged that it might not be meeting the intent, and you get that peer review. And then there's also a site visit. So during that time, the site visit team's also preparing additional questions that they'll ask you on site. And we're trying out a new site visit model. We learned a lot from COVID, and we learned how great this interactive space is, and how it can actually offer opportunities for more voices than when we just say everyone needs to be in a room together for 2 days. So we have a hybrid going where there will be some Zoom sessions where you can have lots of different people joining, but then we also realized during COVID that we can't do everything virtually. So we'll also send the FPHAB staff member and the site visit team chair to the health department to meet with your governing entity, your community partners, health department leadership, health department staff, and really hear and have more of those generative discussions about how public health works in your community. So we'll be able to kind of get the best of both worlds, we think. And then after that site visit and the additional information that's always gathered through that process, then the report is finalized and there's an accreditation decision. We always, it's either you're accredited or you go through an action plan kind of process. So we never would say on that first pass that a health department is not accredited, because they might have additional documentation or there might be other contextual pieces. So if it's not an initial accreditation decision, then the health department would go through an ACAR and would have another year to submit additional documents and go through a review process before the final decision is made. And then, we do see this as a continuous process. So there's annual reporting for each of the 5 years that you're accredited. And in September, we'll be releasing our revised annual reporting process, which focuses a lot more on reflection and learning and helping prepare for reaccreditation. So we think we've really strengthened that step in our process. And the whole accreditation lasts for 5 years, and then you go through a reaccreditation process. So it's kind of a high-level overview of how the whole thing works. But diving in now more on those preparation steps. So I've mentioned a couple times this readiness assessment, and we require it for all health departments applying for either initial accreditation or pathways. And what it does is it steps through each measure, and it includes questions about each of the requirements. So in addition to indicating if a health department has the capacity and the documentation to meet the requirement, there's also space here to provide additional details about it, context, and to ask questions of FPHAB staff. So I think I mentioned earlier that there's 2 different versions of this, and you get to choose the one that best fits you. You could choose the one that just focuses on the 34 foundational capability measures, or you could choose the version that includes all of the measures in initial accreditation. So as health departments are going through this, we really encourage them to include multiple members of their team. Just like how the accreditation process itself and your documentation selection should not just be one individual. It really needs to be a team effort. So we also encourage health departments in this very first step to start practicing that and to engage other staff members and create an accreditation team or domain teams that can kind of go through this together and be really candid about what you have in place and what you aren't sure about and what you don't have yet. I think one of the other things about FPHAB accreditation is that we don't, I know other accrediting bodies say you have to meet everything, and we don't. You know, we've identified those foundational capability measures that are, you know, kind of the foundation to have in place, and that through both initial accreditation and the annual reporting process, health departments will need to meet the intent of all of those measures. But we understand that, you know, it is a learning and a growing process, and that this whole thing is about quality improvement. And so when you first go through, you know, we don't anticipate any health department to fully meet everything. We've never had a health department that fully meets all measures. So it is about that continuous growth and just quality improvement across the health department. You know, and the readiness assessment, it's a lot more than a check the box exercise. You know, I think I just said that we really want health departments to be candid through this. I feel like self-assessments, they're really, you know, you get out of them what you put into them. And the more honest and open that you are, the more helpful FPHAB can be with our feedback and kind of helping give some direction and guidance. Kind of looking at that. So they said we'll step through each of the measures, and you'll say whether you have the capacity, kind of thinking about what we've previously referred to as the 3 prerequisites or the 3 core measures as an example, which are included in those 34 foundational capability measures. The readiness assessment is going to walk through each required element of your community health assessment, your community health improvement plan, and the department's strategic plan. And I'll ask you for that self-evaluation of if the requirements are in place and if you have them documented. I think a lot of the work health departments do, you know, it's just done, but it's not always written down. So this is also an opportunity to identify, like, yeah, we're doing it, but we didn't write that down. So next time we do it, you know, we need to make sure to be documenting it so that that is in place to use for the future. So I'm just going to pick on the community health assessment right now as a plug for Alina's session tomorrow, which sounds like it'll be great. And I hope everyone attends. So when we're looking at the readiness assessment for the CHAW measure, there are going to be 7 required elements. So 7 of these sections that are asking you questions. And it'll go through and it'll, you know, ask these questions. Does the health department have it in place? And during the break, I was looking back and I actually switched the example that I wanted to share today and focus in on required element G of the community health assessment, because it asks, does the department have documented the community assets or resources that can be mobilized to address health challenges? And this one jumped out at me today because I really liked that image that Alina shared earlier. It was the community map that had that visual of all the different parts of a community. And so I was thinking about, you know, if you're coming at this community health assessment and you're thinking about your assets, and what can be used to improve your community well-being. Wouldn't it be cool if that partnership made a map like that and visually depicted, their community assets and resources? And so maybe your community already did this. This might not be an original thought that I'm having right now. It might be something that's done. I think it'd be really neat. And so you might, as you're filling this out, say like, yeah, we have that. But you might wonder, well, is FPHAB going to accept a visual, representation of this? Or do we have to like do some work to like make it into a list? Because the requirement says a list, and so you could pose that question to FPHAB. And on your image, you might have, here's our farmers market, and here's where our support circles are in our community, and here are our schools, and it's all mapped out beautifully. And you'd ask, does this work, or do we have to have like a list? And FPHAB staff would come back and they'd say, that's really cool. Like, no, you don't need a list. A visual description of that works, because if it's working for your community, then that's a great document to use for both for FPHAB, but then with your partnership. And so having some of that back and forth in this preparation, we think that it's a really helpful part of the process. You also might have FPHAB staff coming back saying like, that's so neat. You might want to also, if it's not already in your community health assessment, you might want to include a sentence or two about how you did that, so that when we go through this process and it's identified as an area of excellence, we can then help share that with other health departments, and we can give those tools and tips and resources and everything. And so you'll go through this for each of your measures. And we don't have a lot of data on how long it takes to go through the whole thing. We have worked with some health departments through pilot and some early ones that have gone through this with version 2022. And for those that just like sit down and with a group across the department, are just focused on this, it seems like it's taking about a day to complete kind of full day's work. And this image on this screen shows that we also have a Word copy available of it. So as you're going through, if you're like me and you want to print something out and like actually physically write on it, we do have that available as well. The actual tool is put into this image now, which is an online survey that you can start and come back to, and you don't have to fill it out all in one day. So I reiterate just, the more candid you are in self-assessments, the more that you'll get out of it personally, but also the more that FPHAB staff can come back. And similarly, any questions, I feel like that's one thing that people that are more familiar with other accrediting bodies that haven't worked with us as much kind of question like, well, if I ask questions, is it going to be held against me? The answer is absolutely not. We love questions, and we have really found that health departments that ask more questions as they're going through tend to be more successful. And so, we really encourage that from the very beginning. So then thinking about after you do this, kind of what you get back, we have a report that has both quantitative and detailed comments. So that quantitative data looks across the domain and is going to give you a breakdown for your foundational capability measures. And because that work is so important to the rest of what a health department does, FPHAB staff also provides additional feedback on those. And as we're looking across those measures and really across all 10 domains, but specifically on the 34 measures, we might be able to help identify some themes that are cross-cutting, where additional capacity building could be helpful. So maybe we're seeing a theme around data or data analysis, and we're able to kind of elevate that as something that you might want to address. Or if we are looking at those core plans of your CHA and your CHIP, we might see some themes across them that relate to partnerships. And so then we'd be able to elevate that and recommend, addressing that and provide some tools and resources that you could consider. Another one of the areas where it's kind of a key to FPHAB is around quality improvement and kind of having that culture of quality improvement infused throughout all of the work a health department does. We think that this accreditation process helps elevate that throughout the department, and it's also part of the requirements. And so one of the examples that I saw recently with a health department that filled this out is that there are really gaps with both their QI, their quality improvement plan, and their quality improvement activities. And so we were able to give them some feedback based on lessons learned from other health departments. And it's kind of about meeting health departments where they are, that rather than starting by like creating this plan, since they were very new to QI, start with like 1 or 2 small QI projects. And we gave some tools and resources to start, like how to start small. And then after you get practice in that, then you can, build out your quality improvement plan and start infusing it across the department. And so we're just able to do some of that as you fill this out. So we do give an overarching recommendation for accreditation or pathways, with the focus of that recommendation being on what gaps would need to be addressed to go forward with either path. But it's just a recommendation. Everything that FPHAB provides here is just suggestions, and each health department, it is their decision about what step to take next. We might recommend pathways, and the health department could look at their gaps and they say, no, we can do this in a year, and they can choose to go forward with accreditation. Or we might look and we say, man, you're ready for accreditation, and the health department says, we'd rather take the step approach and start with pathways first, and that's just fine. Related to those preparation steps, we also have our FPHAB's Learning Center, where we have learning journeys and provide live virtual trainings. And so we have a learning journey for pathways and a journey for initial accreditation. And so as you start into this readiness and training step, those become available, and you'll have access to all of them, and you can just kind of choose the ones that are most appropriate for you and the path that you want to go on. So those modules kind of walk through the program, give a lot more details than I shared today, and provide also the fundamentals if you're new to accreditation. We also talk about that documentation in a lot more detail, and provide some tips on how to prepare that, as well as just-in-time trainings for later steps in the process. Our Learning Center, even if you aren't ready to start this readiness and training program, our Learning Center is available and has other materials. We have a series for new accreditation coordinators, or kind of the person that coordinates the accreditation effort in the health department. We have some COVID and QI courses, and an Emerging Stronger series that is videos of health departments discussing lessons learned during the pandemic as they relate to different topic areas of FPHAB accreditation. So how to get started? If you're ready to jump in, you review the standards and measures and the policy. I think I like always have it on my desk. It's a great place to kind of start, and it is a lot, though. It is a big book, but it has all of the details in there. You'll register with FPHAB, pay that readiness and training fee, and complete that assessment and the training. And then you're able to apply. And I did put down here that the first pathways deadline is November 30th. And so each year, I forgot to mention this earlier with pathways. So one of the other things about pathways is it's a cohort model. So we have applications accepted 3 times a year, February 28th, June 30th, and November 30th. And everyone that applies together is then also part of a learning community. And so we'll have a series of calls and webinars, and a place for that group to interact with each other and share with each other, tips and documentation and everything, so that it can be kind of coordinated and everyone can help each other as they're going through the process. So that's why we do have a deadline for pathways. Accreditation doesn't have a deadline. It's just a rolling basis and is done on an individual level, but we really encourage health departments to also be communicating with each other. Just like asking FPHAB questions is great. We think that the more health departments can connect with each other and get, tips and resources and learn what works in other communities, it's going to make your health department stronger too.
Can you say what those dates were again? You said, well, the November 30th is the one coming up, then February 28th. And what was the third one?
June 30th.
So it'll be the last day of those months every year.
Yep.
Okay. Thank you.
Yeah. Really quickly on our fee schedule, because I know that is a question that frequently comes up. We recently updated our fee schedule. So we've kept our annual fees unchanged since 2016. But what we did with this revision is we eliminated the one-time initial fee. So that used to be in the first year, you had a bigger fee up front. And so we were able to, just based on our modeling and because we have so many more health departments that have engaged with us now, we're able to reduce or to eliminate that one-time initial fee and instead have a much smaller the readiness and training fee of $12.99. And then if you go through that process and you apply for either pathways or accreditation within 1 year of signing up for the readiness and training step, we do give you a $500 credit towards either your pathways or your accreditation fee. And the fees are posted on our website. We have a one-pager there. And then another frequently asked question I get, well, what if we aren't ready for readiness and training? And that's totally fine. It happens a lot where health departments need, if you're just getting started on your community health assessment and your community health improvement plan, and maybe your department strategic plan, if you're still, starting your first cycle on those, you might need to take a little bit more time before you're ready to jump in. So even if you aren't ready to officially start that 1 year clock and do the readiness assessment because you know that you have some gaps that you need to address first, I still encourage everyone to use the standards and measures as that guidebook, as a framework when you're looking at updating any or starting any of your major plans. If you're looking at updating policies or, I know this past couple of years, there's been a lot of revisions to emergency operations plan. So as you're doing that, just referencing back to, what is the national standard in the field right now, I think can be really helpful kind of guide as you're going through. And even if you never pursue accreditation, referencing that kind of what the national standard is can be helpful. And then just a quick word on some resources. We do have a lot on our website, as I mentioned. So the standards and measures can be found there, as well as a number of one-pagers and crosswalks and FAQ and a few webinars. Our glossary is coming soon. I think probably sometime next month, our new glossary will be released. And then within the Learning Center, I know I mentioned a few of the courses that are in there, but we also have available the documentation forms, which health departments use when they submit their documentation, but can also just be helpful as you're thinking about the requirements, because that's, it puts all the requirements in one place. And then this documentation selection spreadsheet, which if you're wanting to do your own self-assessment without going through the readiness and training, and you're just kind of curious on what you have, you could use this spreadsheet to start mapping that out. And then, as I said earlier, ask questions as you're going through. I put my email in the chat earlier. Feel free to reach out to me with any questions. And we also have an email address that goes directly to our accreditation specialist staff. That is askfab@fabboard.org. And so they'll get those and be able to answer any process and interpretation questions, or if you're looking to access education and resources, we can help you out. Stop there and pause for questions.
Thank you, Marita. That was really good overview of readiness. I know we have some new people who may not have been with us for the first portion of the presentation. So this second portion was really about the application process and some of the readiness considerations. But I would like to just open it up for just general questions before we kind of go into a little bit of a readiness activity. Now's your time. And I think, you know, seeing those slides, Marita, around Ask FAB, you know, here's my email, reach out. It can be a little bit intimidating, especially when you're talking about accreditation of anything, because it sort of feels like you've got to already be at the standard or whatever, doing everything perfect before you reach out. And just my experience working with FAB has been totally different than that. And when they say email us and ask us, like, they really mean it, and they're there to help, because really for public health, we really haven't had a framework for that long. And this has really been a developmental process over many years. But we're all still learning, and public health is an ever-changing and growing field. And so I really do encourage you all, here's the safe space to be able to ask a question. There are no sort of dumb questions or wrong questions to ask. This is most likely any question that you have, somebody else in the room, also in the Zoom room, also has that same question. So anybody have any questions or comments even? And what oh, yes.
How long, and I know this will depend on the organization, but what's a typical timeline of accreditation? How long will it usually take or typically take?
That's a great question. And yeah, you're right. It depends on every organization and kind of how much time they spent preparing before they start. Most health departments, once they get started, most health departments do take about a year to kind of package and upload all of their documentation. And then after that, it's about 6 to 9 months to get through the review process and the site visit and get that final decision. I will say that almost half, I think it's 46% of health departments that go through our process do go through that action plan step. And that, you know, it really is all about quality improvement, and we're wanting to raise the bar of public health for all health departments. And so, you know, yeah, so.
And I would just add to that, just from our experience working with a lot of tribes in this, including some that are now accredited, is that from the time where you're first learning about it and learning everything that's required to getting to that place where you're really interacting with FAB and the process that Marita has described, it can take anywhere between 3 to 4 to even 5 years. And it just depends on how much time and resources the tribal health department has to dedicate to the effort. Because a community health assessment itself, if it's done well, can take a year. And because preparing for accreditation, there's like so many things that you're kind of working on simultaneously. Even if you're doing the Pathways program, you might be working on your community health assessment while at the same time you're looking at the domains to see, you know, look at your capacity across the other areas. And it may take a few years to get to that place where you're ready to reach out to FAB and say, okay, now we want to do a more detailed readiness assessment and get that feedback from FAB, and, you know, and think about where we can focus our energies. So it does take time, but the benefit is that just by going through that process, you can't help but improve and see positive change. Any other questions?
So where's the best place to start? A little loaded?
No, I'd say if you're just getting into this, the best place to start is by joining Alina's session tomorrow on the community health assessment. I mean, it really, yeah. And then after that, reach out to FPHAB. And as I said, we're happy to have conversations with health departments that are just getting into this space, and kind of talk to you on that individual level about what do you have in place? What, when we're looking at those core plans, like what are your gaps? Where might you be able to reach out to resources? How might we be able to connect you to others to be able to take those next steps forward as you're in those pre-application steps?
Yeah, so those of you who weren't with us earlier, we are, as part of the training summit with Southern Plains, we will be doing a community health assessment training tomorrow, starting at 10 a.m. Central. And it'll be a 3-hour training, and we'll go into some of the details on both looking at readiness for community health assessment, data collection, how do you prioritize, who should be involved, how you build relationships through that process, and how it prepares you to do community health improvement planning as well. So I encourage you all to attend if that's something you feel ready for and is an area of interest. Any questions before we go into our activity?
I have one more question.
Okay.
I'm wondering if you have common missteps that you see happen on a regular basis, like that just end up having people spin our wheels for too long, or so I'd love to hear what not to do.
Yeah, I have two that come to mind right away. One is departments that decide they're going to do it and appoint one person to be the person for accreditation. And they expect that person in a silo to be able to do everything. And it doesn't work that way. You do need a team, you need support across the department, you need everyone to be involved at some level in order for it to work. Because like that quality improvement, as I was talking about earlier, infusing a culture of quality improvement across the organization means that everyone's involved. It's not just one person doing it. And the second misstep that I've seen happen is departments wanting to be perfect before they move forward. And so as I mentioned, like no health department that goes through FPHAB accreditation gets fully demonstrated on everything. That is not the expectation. And so it's really being able to say, I'm not going to let perfect be my enemy. I'm going to, do that foundational work, and then we're going to go for it. And we will continue to learn and improve and grow through the process. So, I don't know if you've seen other.
Yeah, I think what you said was really good, but I also think in light of what Marita just shared, having leadership support is really important as well, because you may have the accreditation coordinator that's sort of herding cats and bringing everybody together to make this work happen. But if that leadership support isn't there, whether it's the director of health services, depending on how your structure is, or even from tribal council, knowing that this is a priority for the tribe will really help kind of get people participating in that buy-in. And because sometimes people will think of this as something else on top of what they're already doing. But what it really is providing people for the first time with a framework to be able to look at what they're doing and how that compares to some national standards. So it's not something on top of, but it's actually to be able to look at what you're doing, self-assess, reevaluate, how could we do better, and then to be able to address it. So I think it does require a little bit of a mindset change, having that leadership support. And then the other big mistake that I see often is people will just focus all their energies on the community health assessment, and they won't look at the actual standards and measures across the domains. And I really, really recommend that you do both at the same time. So you're doing an assessment of the community's health, but you're also doing a self-assessment of what it looks like in your house. And it's this whole idea that if we get our house in order, if we improve our performance, we're going to be able to more positively impact the community and the community's health. So you can't just focus outward if your house isn't in order. So doing both assessments really helps you have a better sense of what's happening internally to the department as well as externally. So those are my recommendations. And it's a great little segue. I know we don't have a lot of time, but what we might do is just for a couple of minutes, break into 2 small groups. I'm going to pull up the PowerPoint, and I'm glad you mentioned that slide because I actually brought it back up again. I hadn't planned to show it again, but I actually over lunch started making adjustments to it again to be able to share with everyone. So I'm going to pull it up. Let's see, here we go. So for those of you who are with us in the morning, this was the slide I shared around understanding our community wellness. And this graphic comes from the American Indian Cancer Foundation. And while it focuses on healthy eating specifically, this graphic, if we were to think about public health performance across our tribal nation and all the different stakeholders and partners, as well as the different places, our ceremonial grounds, our natural environment, all these different areas, our farmers markets and gardens, these are all the different places and partners who have community health at the very center. And Marita was talking about it in terms of, how do you figure out who gets involved in public health accreditation, your stakeholders, or even looking at your needs and assets within your department for your community health assessment. This is a graphic that helps to illustrate that. So when you think about your tribe or the tribes you work with, our tribal public health system has a variety of stakeholders, and we talked about this earlier. And you might actually, from our representatives on the call, might be one of these system stakeholders. You might actually not be working for a tribe, but work with a tribe as a partner with the main goal of improving health. And so when accreditation is essentially looking at the 10 essential services, it really is, how are these system stakeholders and partners working together to implement those? And so I want to take just maybe 7 minutes or so to take a look at the worksheet that we've provided. And Teresa has put a Dropbox link so that each of you can download this worksheet. And one of the values of this worksheet is that it has some of the main, has each essential service listed, and then it has some of the activities that occur underneath that essential service. And so what we want to do is to just give you some time to talk to each other and talk about who the system stakeholders are that are doing these activities in your community. So in your case, it might be, well, I work for a tribal epicenter and we provide these services. Other tribes might say, well, we have an epidemiologist who actually collects and monitors this data. Who's doing those activities? Have a conversation. And part of this is about learning who's doing what, how it looks different in other tribes, and just have a conversation about each essential service. So all 10 are listed. We probably only have time to talk about 1 or 2, but you can use this worksheet to have these conversations within your tribal health departments and begin thinking about who are we going to need to engage to understand our readiness for public health accreditation. So with that said, we're going to, this is a little bit, we weren't sure how big of a group we were going to have. So download that worksheet. It will be your first step so that you have it. Again, that link is in the chat. We're going to just put you into 2 groups. And let's have group 1 start with essential service 1. And let's have the second group 2, and you'll see this, which group you're put into, start on essential service 7. And just that way we're reading 2 different ones. And if you get through one, just go ahead and go on to the next one. So read through your assigned essential service, talk about who those partners are in your community. And then when we come back, or before we come back, identify someone in your group to kind of just share what your conversations were. So we're going to allow for about 7 minutes for that. So I'll stop sharing. and we'll go ahead and go into small groups.
Great. I'm going to open up the rooms. You'll be prompted to join a room. If you have any questions, there's an option at the bottom of your screen. It'll notify us. Directions are in the chat. You'll be able to see them in the breakout. Go. Andrea, are you having trouble getting into your breakout? Or maybe you stepped away? That's okay. There's 3 in each room right now.
Yeah.
I can go ahead and pause the recording if you guys would like.
Oh, yes, please.
Okay, here we go. Open the rooms.
Welcome back.
Here they come.
Looks like we have one group that's gonna
Wait, take it.
wrapping up. Yep, here they come.
Here we go.
Is that everybody back? Okay.
Like it.
So, all right. Well, just due to our time, unfortunately, we're not going to be able to do our report outs like we had hoped because we only have 5 minutes left. But what our hope is that worksheet and the conversations that you started to have are conversations that you can have within your communities and who's doing work across those 10 essential services. Because one of the questions we always get asked is who should we involve? Who should we engage in our accreditation effort? And this is a good place for you to start thinking critically about all the different partners you work with across the domain. Now, it doesn't mean that every partner will be engaged equally in your accreditation readiness effort, but when you start doing your readiness assessment, like what Marita talked about, this would be the good group to sort of bring together and to learn more about what they're doing, how they're doing it, whether they think they've got that documentation. Those are the conversations that you can start to have. And it also is a really great way for helping people across the tribe and the different partners you're working with to begin to think about accreditation and how ready they are. And I think that a lot of times as people start reading the standards and measures, they do find that they're doing a lot of the activities that are there. And again, like Marita shared, it's just sometimes it may or may not be documented. So I just want to wrap up with just a couple of just resources to share. I want to point out to Marita's slide, which I brought up again here. FPHAB really is the go-to resource for knowing what's required for public health accreditation. But there are a number of organizations that do provide some support in accreditation readiness. And the National Indian Health Board is one of them. Many of the area Indian health boards or tribal epicenters also have resources. The 7 Directions Public Health Institute at the University of Washington is a resource. And then we are a resource as well. And so I welcome you to visit our website. We have some resources for accreditation on our website. However, they are not aligned with version 2022 as it has just been released, but are based on the earlier versions and the experience that we have with tribes. You can also go to our website to join our listserv. So as new resources are released and updated, they will be shared on our quarterly email list. And you can also follow us on social media on Facebook. You'll find us there as well. So with that, I just want to thank you all for your time today and for your attention. And we just really appreciate this opportunity. And again, we'll be presenting on community health assessment tomorrow, but we'll also be presenting on Thursday about implementing the 5 A's outside of the clinical setting. So you can join us for that training as well. It's very interactive and hands-on. And so with that, I just want to thank our team as well. And Southern Plains Tribal Health Board, thank you so much for having us. And I'll turn it over to Mary Frances to share any final closeout logistics and things.
Thank you. It was a pleasure having you here, and it was an amazing presentation. I learned quite a bit. So thank you, Teresa. Thank you, Marita, and thank you, Lena, for being part of this. Thank you again to the participants also for being a part of this. We have an evaluation. I'm going to go ahead and share my screen and kind of show you where you can find that evaluation. You were sent a login link today, and so it takes you to the main CVenta page. If you go ahead and scroll all the way down, there'll be a little box here that says take a survey. You go ahead and click there, and then you'll find your session, the session name. So we have Tribal Public Health Accreditation. Go ahead and click that, and it'll lead you to the session feedback form. Alrighty, and that concludes today's session. Thank you everyone again for being a part of this, and I hope to see you guys at the next session tomorrow.
Thanks, everyone.
Thank you.
Ako, Pilamay. Thank you.